Thank you for joining us for another Arthritis Wellness Conversation. My name is Sandra Sova, and as always, I am joined by a research scientist from Arthritis Research Canada. Joining us today is Dr. Mary De Vera. And we also, as always, have members of the Arthritis Patient Advisory Board. Joining us is Allison, Eileen, and Trish. Today's topic is pregnancy, parenting, and living with arthritis. We have a few different perspectives on the panel today, so let's just jump right in and start the conversation. Dr. De Vera, what are some of the issues that women with arthritis tend to face in pregnancy?
So I guess, first of all, I think this is such an important topic because, arthritis is so misunderstood. People tend to think of it as a disease of older people, when really it does impact across all ages, and it impacts women especially. So it impacts their ability to be able to get pregnant and to have safe pregnancies. So one of the issues right now is whether women should take medications or not. Arthritis is itself a risk factor for many pregnancy complications. So it's not a matter of, when a woman who doesn't have a chronic disease, when they get pregnant, they tend to not take medicines, they don't eat sushi, they don't drink. So, the recommendations are clear. But for women with arthritis, not taking medications could actually be harmful. So that's actually one of the biggest issues that we study in our research.
Absolutely. And, as things have changed and there's so much value that goes on with research in the area of arthritis. I know that when I was in my mid-20s, I was told rather matter-of-factly by a rheumatologist that I really should consider not becoming pregnant and starting a family because of my rheumatoid arthritis. That was 30 years ago, mind you. Is that something that anyone on the panel has been advised not to have children?
I was advised that when I started some of my biologics to definitely not get pregnant on them because there would be some severe reactions. And I've also been advised to not have regular forms of birth control that a healthy woman could have because I'm at increased risk for blood clot or stroke. So that kind of really changed my opinion on having another child since I was diagnosed after my son's birth. But when I asked my rheumatologist right after I was first diagnosed, I said to her, can I have another child? And she was very honest with me and said, you can, but most women only have one. And I think I understand that now. It's because it would be so hard on my body now.
So I am not, right now, I'm not even thinking about having kids, but it is something I'd like to do in the future. And I was diagnosed so young. So I was diagnosed at 3 and I've been on medications all my life. So, and it ranges from methotrexate to a biologic to there's a stint where I was treating chronic pain with opiates. And so all of these have come into factor of how is my body going to react to having a kid? Will I be able to get pregnant and things like that? But also, so my doctor hasn't said that I can't have or shouldn't have children. She did say that I need to give her at least a year to 18-month warning so that I can come off some of my medications. But there is that fear too, is with the biologic, it is technically safe from what she said, but in the back of my mind, I'm how much do we know about it and how it affects 50 years down the road since they haven't been around that long? There's just a fear in my mind, but I don't know. So there's definitely a lot to consider, or that I have considered.
That's another reason why having a really good, strong relationship and communication with your healthcare providers is important for someone like Allison to be able to plan and to think about these things and the big picture.
Absolutely. And actually, that's some of the things that we're finding is to actually have that conversation early, even if, pregnancy is still years down the road, but just to kind of, have that check-in so that, you can plan for birth control, and then to also give the enough lead time to be able to plan, what medications you could stay on when you're conceiving, and then what medications you can stay on when you're pregnant. So that is definitely one thing that we found, that, Some women that we've talked or interviewed said, they haven't had that type of like relationship. They haven't felt supported in their decisions. We've also found some women that, have had those relationships that, they were able to carry the pregnancy successfully and then transition into motherhood and then also plan for that subsequent pregnancy. So actually some of the things that we're working on findings is tailoring that messaging to patients, but also to the healthcare providers, because we want the conversation to come from both sides. So it's not always patients having to go ask their doctors. It should also be the doctors offering and just, initiating those conversations.
Mm-hmm.
And then I guess I wanted to add to Allison's concerns about like biologics. So I guess it's a little bit of good news or some of the reassuring things that we've found. So we've been studying biologic, oh my gosh, for the past 7 years since I started my appointment as an assistant professor. Because at that time they had just been in the market for just over 10 years. We really needed to understand, what are their impacts on the moms and the babies when they're taken during pregnancy. So over the past 3 years, we've actually published a series of papers where we've shown that they're not as with a lot of the adverse outcomes that we tend to worry about with medications in pregnancy. So there's no association with preterm births. There's no association with small for gestational age babies. And there's no association with congenital malformation. So that's a major thing that people worry about, especially when you consider that, some arthritis medications like methotrexate are actually teratogenic. And then there's no connection with infections in the mom and infections in the baby, which is an important potential complication considering how these drugs work. So some reassuring research that we've published. And again, we're working a lot on how do we take these findings and communicating them so that patients are aware and also that doctors are aware that, we have found that there are no associations with these complications.
One of the things that I was curious is, does having arthritis impact a woman's fertility or her ability to conceive?
Yes, so studies have shown that it does. So women with arthritis tend to have less children compared to women who don't. And they also take a longer time to be able to conceive. So again, this ties back to just that relationship and conversation with the healthcare provider so that pregnancy and reproductive decisions can be planned ahead of time so that we can have successful outcomes.
Thinking about when you do have arthritis and you are going through a pregnancy, did your arthritis change while you were pregnant?
I wasn't actually diagnosed quite yet when I was pregnant. I started experiencing symptoms of rheumatoid arthritis around 24, but it was during my pregnancy that I could tell something was definitely wrong with my joints. And I've never experienced such horrible swelling in my existence since, but I might with RA. And it was after my pregnancy that I had to see my doctor and ask to be tested for rheumatoid arthritis. It just came so apparent that something was really wrong with me.
What about you, Trish?
Yeah, so I have a little bit different story. I was diagnosed with osteoarthritis. I was one of those 22-year-olds that had a sports-related injury and had surgery, and my surgeon said that I would get arthritis. But at 22, I only knew arthritis to be an older person disease. So I was thinking, I get it in 60s or 70s or whatever. But in my 30s, when I was pregnant, the last trimester, everything just, so the swelling, the joint stiffness, the pain, everything just exacerbated. And it was really difficult. And I thought it was part of pregnancy. And I didn't think of it as arthritis because I had some symptoms before pregnancy, but a lot of them were written off by my GP or other healthcare professionals as my sports injuries. They were sore muscles or affiliated with my impact with badminton or skiing. So we really didn't know I had arthritis. But after pregnancy and after delivering, my symptoms didn't go away. They actually got worse. And we got x-rays, and the x-rays were the ones that told me that I had arthritis because it was, very visible on x-rays. But I'd say the pain, the inflammation, and the joint stiffness, the changes in my center of gravity, and that ligament changes in your last trimester. I think beforehand, my muscles were really strong. And maybe that's why I didn't have all the symptoms showing because I was very athletic. My muscle strength was there. But after the pregnancy, the muscle atrophy, the muscle weakness, just everything changed. For me, it was post, really, that last trimester and post pregnancy, that I really found out I had arthritis, and then having to adapt to that new life.
And is that something that you typically hear, Dr. De Vera, that arthritis is coming on a little bit stronger during and post pregnancy?
So I guess along the same lines, when when we started the conversation, that there's these just misconceptions before. So in your experience, you were told that you couldn't get pregnant, or you were advised not to get pregnant. So I guess interestingly, there's been also like this long-standing thought that RA goes into remission during pregnancy. So for the longest time, you'll also hear people getting said, like, get pregnant because that's your RA will go into remission. But actually that has been, evidence has since come along that that's not, in fact, not true. So I actually have some numbers. So at least under half will continue having active disease during pregnancy. So again, that's why it's important to, have that plan and be able to consider the medications that are compatible with pregnancy, because now there's evidence for these medications. And then about 20% will actually experience a moderate to severe disease activity, particularly during the third trimester. And then speaking to what Trish mentioned, about 40% will experience at least one postpartum flare. So it is like a disease that will continue progressing even during that perinatal period.
What sort of challenges does having arthritis bring to your role of parenting?
Well, I think for me, just adapting my lifestyle. I wasn't able to be physically as active as I wanted to be. So I had to choose what I could do and focus on the positive aspects. And, I was able to read with him. I was allowed to be able to play board games or do other types of activities that I wasn't involved in running or high impact sports. I did push through for a few years. When he was a kid, I actually, because I'm a skier, I wanted him to learn how to ski. So I thought in my mind I would be able to ski the green runs and ski with him for a couple years while he's learning. Well, not even 3 times. He's already down the hill and I'm trying to keep up with him. So I knew that I wouldn't be able to ski with him very much longer. And I knew that every time I skied, I would pay the price for a couple days. So I would sacrifice to be able to have that moment, that time with him and those memories. So it was tough having to give up throwing the softball or his baseball, being participant in his physical activities. But, there was other things we could do. So we had to modify kind of my first 6-7 years of having my arthritis. And then he was a little bit older and then he understood. And I think that's another thing is my son is very empathetic, very compassionate, because he's seen me on my good days as well as the days that I struggle. So I think that is kind of a cool thing that he's learned through this whole process. Sorry, I'm getting a little teary-eyed because I always kind of think of what I've had to give up, and I'm still funny is grieving who I was or who I thought I was. So as a mom, my role might have been a little different than my sister-in-laws or my girlfriends. But we figured it out.
Thank you.
That's really touching. I mean, that's really going straight to my heart, Trish. And we did a study where we interviewed women with RA, and some of the themes just reflected what you just said. So they've had to make a lot of adjustments. So even things like being able to breastfeed. So for some of the moms that had a lot of hand or wrist involvement, they said they just couldn't breastfeed because they couldn't hold the baby. And then they also told us about just some of the baby items, like car seats could be really hard on the hand. So there was a lot of like relying on the partner and family. And then, just adapting their activities. So they can't do a lot of the physical activities, but then they will just do a lot of reading. And then what you just said about your son being empathic. So one of the, I guess, beautiful things that we came out with this research was a lot of the moms told us that their children are a lot more empathic, a lot more sensitive. They're so kind because they've seen what their moms go through. So I feel like I'm going to tear up because you just really just brought our research to life with what you just shared.
Absolutely. Eileen, I know that you are a blogger, and one of the things that you started focusing and talking about is being a parent of a young child and rheumatoid arthritis.
Well, particularly with rheumatoid arthritis, it is one of the diseases that definitely causes disability for a lot of people if they don't get treated in time. So I think one of the biggest challenges for me personally has been a single parent getting by on disability. And it's not just the financial aspect of that, but also because I am a single parent. I'm all on my own. So it's dealing with all the chores of and everything that comes with raising a child from birth till he's almost 8 now. So I've been going through pretty much his entire childhood, and watching my body slowly change each time, each year as my disease progresses. So it can get challenging in different ways each year and as he grows, particularly when he was a baby, before I was diagnosed. Wearing a baby sling was really kind of something I wanted to do because I had hand and wrist pain. So I thought, well, maybe I could just wear him. But even just wearing him was too painful. I couldn't handle 20 minutes just wearing him. And I remember feeling like I wasn't like the other moms. And then I felt like I missed out on so many opportunities, and I couldn't breastfeed too because of pain, but I wasn't diagnosed yet. And that a lot of people are breast is best, but when you're dealing with an illness, it's not necessarily breast is best. It's as long as your baby gets fed, and what helps a mom be able to be the best parent she can be and take care of her illness.
Allison, you're not, as we know, you're not yet a parent, but you mentioned that you do think about how to balance everything.
Yeah. Right now I'm lucky because my arthritis is generally pretty controlled with medication. And so I am still able to work, and I'm working from home right now. And so there's those, but that idea is like the balancing, and like, how do you, at what age does your child understand what you're dealing with? Or like, and at what age can you start having these conversations with your kid and feeling like they're hearing you, and that like, yeah, your parenting is a bit different, but that they like, and so that there's not that like resentment or anger, or like, have you had to deal with that, like, for as parents, like dealing with your kid or not being able to take them to the park, or not being able to take them on a hike or something like that? Like, or do they understand, or have you guys found that they've understood?
The younger he was, the less he understood, but the older he gets, the more he understands. And also the more in depth with my diagnosis I find ways to balance going to the park and life. So has it gotten easier? Yes and no. As Trisha said, like, my son has grown into being such an understanding, empathetic and compassionate little guy for somebody who's not even 8 yet. And I know that it's my diagnosis that has taught him this, and that would be something that I wouldn't be able to give him if I didn't have this diagnosis. So it's always important for my mental health is to find that silver lining. And I think that's probably the biggest one for me.
I think also we need to look at not trying to do it yourself and be a super mom, because I felt guilty that I couldn't be there for him like I wanted to. So I actually finally started talking to friends and family and explaining what I was going through, and they had no idea because I had hidden it for so long, because I was one of those tough, independent athletes that no pain, no gain, just push through it. And, and I thought, I finally got to a point that I started asking people to go for walks with me or go to the playground with them and their kids. So I wasn't alone in case of an emergency or something happened that I felt uncomfortable with. I always had somebody who understood and said, oh, Trisha, I'll go get him. He's just, gone on the slide or something, or they would help out. So I think the one thing for me as a parent was learning how to ask for help, not feeling that I was a failure as a mom, and then knowing that we had a community. And I always think, they have that saying about it takes a community to raise a child. Well, if you have arthritis, it really takes a community to raise a child. And it's nice knowing that my family and even some of my close friends stepped up, and they didn't even bat an eye, that they kind of took over some areas that I had difficulty with. And then there was a couple years when Jackson was little and I was battling depression. I don't remember some of his baseball season. I don't remember some of the activities, but I had family that would take him to baseball or, join in when I'm there just to keep me engaged and keeping me part of the whole activity and stuff. So I think building a community is really important when you have arthritis, and especially when you're raising a kid.
There's such good and important and valuable information being shared here. I love hearing the correlation between having a mom who has some challenges, such as arthritis, and having that translate over to raising more compassionate and understanding young people. And hopefully, in turn, future generations will be more open in talking about these things. Trish, I can relate so much with that, putting on that facade and that armor of things being okay and that we can do it. I think that having conversations like this is empowering and encouraging that it is a normal part of many people's lives and that we should talk about it. We need to normalize all the different types of situations that are happening, and that we can normalize these types of conditions and lifestyles and get support for one another, because that is so important. And that's where we have much better outcomes for both our physical and our mental and emotional wellness.
I think one other area that you don't think about, but when you're raising a child, also you have a spouse sometimes. For me is I had to learn how to change up intimacy. So a lot of things were different after my arthritis diagnosis and having a young child. A lot of things change because if you're in pain and everything, it's hard to kind of be in the same role that you were in before, and learning new ways of connecting with your significant other. And I think that was also another challenge for me in those early years, was you have a new baby, you have a new diagnosis of arthritis, and you're trying to juggle everything, and you don't want your spouse or significant other to be left out of the picture. So that was a hard juggle as well. So I don't know if people talk about that, being a new mom, but that was one of the other areas that I forgot I dealt with back then, or had to kind of figure out a new way of doing things.
So, so it's interesting. So, when we were, so from some of those interviews, they actually brought in the roles of their partners, and that actually inspired us to do a spin-off study where we interviewed the partners, because they really wanted to share their own experiences. And some of the stuff that they've shared, some of the stuff that have come out of those interviews were actually also very insightful. So, they want to be involved. So some of them felt that, the wives, again, were trying, or the partners, sorry, not all of them were married, but their partner with the RA were trying to be strong, but the male partner, for all males, wanted to help, but they found out like the woman was almost trying to like just still be the woman. They didn't want to like let their disease like take over the relationship. So the men want to help, and then we also found that they also were processing, and their own mental health were also being impacted by watching their partner deal with disease, deal with pregnancy, deal with motherhood. So some of our recommendations from that is to have more involvement. One of our rheumatologist collaborators, because we're now looking at the paper, we're about to submit it, she said, this actually reminds me to invite the partners to the appointments and not just the patient. So yeah, partners have an important role for sure. And they've kind of been neglected, or, so I think we also need to recognize that they also need care.
That's a really good point.
I guess if I could add a couple more things. So I guess just some more words of reassurance that we know a lot more about arthritis and pregnancy now than we ever did. And there's actually even more guidance. So in 2016, the European League Against Arthritis and Rheumatism their recommendations. In 2018, the American College of Recommendations published their recommendations. So there's guidance for healthcare providers, and there's evidence for the safety of medications. So I guess now we're kind of bringing up the other end is talking to the patients to see, are these new guidance, are these new recommendations kind of filtering down to their care? And if there's gaps, so how can we bring it? Because there's evidence and information. They need to get to the healthcare and they need to get to the patients so that they can make reproductive decisions that they feel comfortable and confident in, because I think that's ultimately what's going to support a healthy pregnancy and a healthy parenting and family life.
Adapting around the house, when he was little, you're given a lot of things that are very difficult to manage and work with. And I think for me, the biggest thing was the stroller, because I could walk. I couldn't do a lot of other activities, but I made sure that the stroller was ergonomically friendly, easier on my body, the right height, so I wasn't in a position that would put more stress on my joints. Modified a few things and made them a little higher so it was easier for me to get him out of the crib than if it's too low and stuff. So I think looking at a few different things, that you can do things, you just have to modify them. So not just mentally or physically for my body, but ergonomically around the house, adjusting things, and for bathing, I had difficulty getting down and kneeling and bathing. So we had to figure out another thing in the sink or get another bath kind of basin and stuff. So we had to look at a variety of different things to make sure that I could still do those things that didn't put more stress on my joints. And then also too is looking at some of the other things for me is the height of some of my chairs. So if I was holding him and stuff, it was easy for me to get up, because if they're too low, if I'm holding him, I had difficulty getting up out of those chairs. So I had to look at a variety of different things. So I didn't want to miss out on some of those things. So we had to kind of look at changing things up. And I remember the stroller was one of the biggest things, because that gave me more freedom. And I was able to go out and do some walks with him a lot more than I would have in those little tiny strollers and some of those other ones that weren't as nice and friendly to my body.
Mm-hmm.
I was wondering, Trish, did you have a support from OT? I keep thinking about our OT colleagues at ARC, because you need help. There is help, and there are the trained healthcare providers who can provide those supports and those adjustments. And if for listeners that that help is available. So did you have to do that by yourself, or did you?
I had it by myself, and until I started going and realizing, I was in denial for the first bit. Sorry, I'm going to say I was in denial for the first 5 years, and I tried to push through it. And then I started to have access to some education events. So I went to an arthritis self-management program. I went to a chronic pain workshop, and I went to a few other things. So once I started learning a little bit more and accepting and understanding my disease, knowing that there was no cure, that it was going to progress, and I just had to figure out how to kind of halt it or slow down the progression, and how to figure out how to do that, but also modify how I did it with my child and figure out what worked for me. So, I got walking poles, I did a whole bunch of, looked at footwear. I looked at a lot of different things so I could still be active with him. So I was able to walk with him. So there was a lot of things I learned later on. And some of the things like listening to Eileen and reading her blogs and some of her things on parenting tips, I found going, I wish I had that information 20 years ago, because my son just turned 22 in May. So for me is, if I had had those tools back then, I might have had a little bit more of an easier time of it, and I might have been able to do different activities that I wasn't able to do. So I think with these education series or wellness conversations, I think if we're able to help somebody have at least one or two little tricks or tools that they can enjoy their child and their parenting and things that might work for them, I think that's important.
If I could just add to that, and I think again you hit the nail on the head, that there is a lot more information and a lot more supports out there, so that women who are going through these decisions and the experiences don't have to feel alone, because like living with or dealing with chronic condition is very self-isolating and very lonely. So there's great blogs like Eileen's blog is such a wealth of just information and just like real life experience, right? She tells you what it is, but in the most beautiful way. Women are helping each other. So you don't have to do this by yourself. So for anyone listening, there is a lot more, again, there's a lot more evidence for safe medications, and there's a lot more information and supports out there.
Well, thank you. I think that's a great note to end on. I'd like to thank everyone for their participation. You have been joining us here for an Arthritis Wellness Conversation, hearing from individuals that are just like you, living with arthritis. Thank you so much, and we will see you next time. For more information and to watch additional Arthritis Wellness Conversations, head over to arthritisresearch.ca.